as you're listening today, I encourage you to walk. That way you're listening and learning. My name is Clifvonne Webb. I'm a fourth year medical student at Rush. My favorite type of exercise, I guess when I want to torture myself, the Stairmaster, but if I want to have fun, I love a good dance class. And I have the pleasure of introducing Dr. Rowley today, Dr. James Rowley. Dr. James Rowley is a pulmonologist, and he's the program director of the Sleep Medicine Fellowship at Rush University Medical Center. He previously served as the president of the board of directors for the American Academy of Sleep Medicine, the largest U.S. organization focused on advancing sleep medicine. In his personal time, he enjoys walking for exercise. So let's hear some wise words from Dr. Rowley.
So I'm just going to go over a little bit about what is good sleep, what is bad sleep, and then just a few slides on how to recognize you might have a sleep disorder, so that if you do feel that you have problems with your sleep, you know whether or not you need to come see one of us here at the Rush Sleep Disorder Center. So why do we sleep? Generally, it's worked out for the most part that we sleep for both brain function and physical health. Particularly for the brain, during sleep, you clear out waste products that accumulate in the brain during the day. There's consolidation of memory, and there's evidence that sleeping helps regulate your mood and emotional responses. In terms of your physical health, it promotes tissue growth and muscle repair, strengthens the immune system, and it helps regular hormones that control hunger. In other words, people who do not get enough sleep, they can have the hormones that increase hunger be a little bit more predominant, and therefore weight gain is often seen in people who do not sleep enough. Approximately 1/3 of Americans will complain of insomnia at least a few nights per year, with half perceiving the problem as serious. And approximately 1/3 of Americans will complain of being excessively sleepy at least a few days per year, with 6% complaining of excessive daytime sleepiness daily. Excessive daytime sleepiness can affect not just yourself, but others. In various surveys, upwards of 60% of adult Americans reported having driven while drowsy. 23% will admit to actually dozing off at the wheel. And approximately 1% will indicate that they have an accident they attribute to falling asleep. So driving drowsy is actually a big problem in the United States. So I'm frequently asked, how much sleep do you need? And there is the one answer that you need as much sleep that you will be awake and alert throughout the day. For the average adult American, that is 7 hours of sleep as recommended for the American Academy of Sleep Medicine. Most adolescents also need 8 to 9 hours of sleep per night. The adult years, 7 hours is usually the recommended amount. About almost 2/3 sleep less than 8 recommended hours of sleep. 44% compensate by sleeping longer on weekends. And about 51% of men and 42% of women would go to sleep earlier if they didn't have television or access to the internet. How does one get a better night of sleep? The first thing to do is to practice what's called good sleep hygiene. So sleep hygiene are all the things you do as part of your bedtime routine that help promote sleep. And the most important thing to do is developing regular sleep habits, including a regular bedtime and wake-up time, particularly a regular wake-up time. When you wake up in the morning, helps set your circadian clock throughout the day. It helps you fall asleep at a regular time at night. One, again, should sleep 7 hours per night, and you should never go to bed unless you're outright sleepy. One should always slow down and unwind before bedtime. Bedrooms should be dark, cool, and quiet. Daily exercise is fantastic for sleep, but if you do want it to help target sleep, it's best performed in the late afternoon. And a light snack, and the key words there are light and snack, not a meal, before bedtime can be beneficial for going to bed. I also like to emphasize the slowing down and unwinding before bedtime, but one should really take some time to relax before you go to bed. You shouldn't be working, and then try to go to sleep. So then there are some things that are considered bad sleep hygiene. These things are things that you do that can actually end up preventing you from sleeping. Although I would say there's a couple of things on here that if you do them and you fall asleep right away, then it may not be the worst thing for you. But in general, these are the things you should avoid. So you should never try to force yourself to sleep, meaning that you shouldn't get into bed half awake and then try to fall asleep. That just has the paradoxical effect are keeping you more awake. You should not take your problems to bed with you. There's actually evidence that you should, if you're someone who thinks about a lot about what's going on at night, when you get into bed, you can keep what's called a worry diary, and you can write things down before you go to sleep, and that helps you get them off your mind. You should not do strenuous mental or physical activity just before bedtime. Caffeine and tobacco are stimulants, so they should not be used before bedtime. Alcohol is a sedative, but it's a bad sedative, and wears off quickly. And so it ends up you have a worse night of sleep after it has worn off. In general, one should avoid alcohol for about 4 to 6 hours before bedtime. One should not read, eat, or watch TV in bed. All those things have the counterproductive of keeping you awake. And there should be no electronics in the bed, particularly the cell phone. And if I had to pick one thing that I see more and more of, it's the cell phone in bed. The cell phone should be on your bedside table, being charged upside down, not in your hand when you get into bed at night. It's a bright light that's right in your eyes. So one is going to decrease your natural melatonin production, which means you can't fall asleep. Plus, you're usually looking at things that are stimulating you. So again, it's difficult to fall asleep. So I cannot emphasize no electronics in bed. I am frequently asked, is sleeping good for you? And it's a somewhat complicated answer. An occasional nap may be a reasonable way to catch up on some sleep. This is especially true if you had 1 to 2 nights of poor or restricted sleep, then a quick nap during the day might be helpful. However, if you find that you need a nap every day, that could indicate one or two things. One, that you're just not getting enough sleep. And again, that means 7 hours of sleep per night. Or you might have a sleep disorder. And then that might be time to think about coming in to see a sleep physician. The other thing I'm asked is if I do take a nap, how long should it be? And the answer is 15 to 20 minutes. So you may think a longer nap is better for you, but the reality is that after about 20 minutes, you may have what's called sleep inertia upon awakening. So sleep inertia is the inability to get functioning again quickly after you wake up. And the reason that happens in more than 20 minutes is that after more than 20 minutes of nap, there's a good chance that you'll be in slow wave or deep sleep. It's very hard to wake up after out of slow wave sleep. And so the result is your brain just not ready to function. So you actually can end up spending more time away from the activities you were going to do than if you just took a 15 to 20-minute nap. So there's a lot of stuff out in the media and social media about things that can help you fall asleep. And I'm here to tell you that most of it is a bunk and would not necessarily try these things up front. So melatonin, of course, is extremely popular, and I do not doubt that it does help a few people. But you should know that melatonin has been reasonably well studied for insomnia and does not work for outright insomnia. And part of the reason for that is that melatonin levels actually rise hours before you go to sleep. So taking it just at bedtime really doesn't make much difference. There are a couple of very specific uses for melatonin in the sleep disorders field, but insomnia or inability to sleep is not one of them. There's a lot of lay press about magnesium that helps you sleep. I've heard about the magnesium mocktails at bedtime. Doesn't do anything. Magnesium has no real role in sleep inducing sleep, and so would not use it. There are other supplements that are advertised as helping you with sleep. Tryptophan and valerian root have been specifically advised against by guidelines put out by the American Academy of Sleep Medicine. There is something out there called sleep maxing, and this is all the things you can do to help you get a good night's sleep. But it's really just good sleep hygiene on steroids, meaning that if you just follow good practices of sleep hygiene, you don't need to sleep max per se. You can probably get a really good night's sleep. And then there's also a craze these days of mouth taping. I would tell you as a sleep physician, I'm not in love with this thought. Your mouth needs to be somewhat open at night to let air in and out. There may be some mild evidence that it can help snoring, but as a general measure, to help you get a good night's sleep. There really is no evidence for mouth taping either. Sleep apnea and insomnia by far and away the most common sleep disorders in the United States. Narcolepsy is relatively uncommon. Restless leg syndrome is a pretty common disorder. And I put shift work disorder in here because depending on who's listening in today, this is frequently can be a problem amongst shift workers at hospital systems, particularly nurses and other staff who work at night. So when might you just think about you might have sleep apnea? So if you have loud, heavy snoring, gasping or choking at night, breathing pauses witnessed by a bed partner, morning headaches, waking up unrefreshed, daytime sleepiness, and if you have an elevated body mass index, either in the overweight or obese categories, overweight being, of course, a body mass index between 25 and 30, and obesity greater than 30. This is also tends to be more common in men than in women, but women catch up after menopause. So, but if you particularly a middle-aged male who snores and body mass index is 30, definitely have a higher risk of having sleep apnea. Or might you have chronic insomnia? And this one is definitely important because all of us will have nights of insomnia. It is almost impossible to say that someone will never have one. Some big life event will happen and you will just have difficulty falling asleep. And the common ones, of course, some big exam, your wedding, the death of a loved one, a big move, all of those will cause a few transient nights of insomnia. But some people go on to have chronic insomnia, which is usually defined as more than 3 months of difficulty sleeping. So it can be the inability to fall asleep or stay asleep. People with insomnia do feel sleepy, but as soon as they start their bedtime routine, often wake up. They have frequent racing thoughts once they're in bed. They try to force themselves to sleep or they feel tense in bed. Eventually, they can get to the point where they worry about getting to sleep throughout the day. Interestingly enough, a lot of these patients can sleep better on the couch or away from home. So most of us is what's called the first night effect. So the first night you're sleeping in an environment you're not used to, you usually have a difficult time sleeping. But sometimes people with insomnia actually can sleep better in those situations. And then people who feel, often people with insomnia can feel fatigued during the day, but actually cannot nap. So restless leg syndrome is a common sleep disorder. It is more common in women than in men. It's actually more common in pregnancy as well. There are 4 key symptoms of restless leg syndrome. First is the sensation of restlessness in the legs. This restlessness is often described as a creepy crawly feeling. The second one is that creepy crawly feeling will get better if you move your legs around. It should happen primarily if you relax your legs, meaning that they are elevated in some way, shape, or form. So usually recliner, putting your legs up on the couch or in bed, and then should only happen in the evening hours. If you have all 4 of those things, then you have a good chance of having restless legs, and there are ways of treating it. If you don't have quite all those 4 things, ask any family members if they have similar symptoms. This is a very common familial disease, and often you can find siblings or parents who often also have RLS. So how might you know if you need to see a sleep physician? Again, loud, bothersome snoring, unrefreshing sleep, excessively sleepy during the day with the need for napping, or chronic fatigue or tiredness may be all reasons to talk to your primary care doctor about a referral to see us. There are also a lot of online questionnaires that you can do that might indicate a need for a sleep physician. For some reason you think you have sleep apnea, you can do what's called a stop bang. All of these, if you just put these into your Google search, you will come up usually with a PDF or a calculator online. You can score yourself and see what you get. But the stop bang is very good for sleep apnea. There's something called the Epworth Sleepiness Scale for sleepiness, the Insomnia for Severity Index for insomnia, and there's a Restless Leg Syndrome Rating Scale for RLS. And all these websites would tell you what would be a quote an abnormal value. And if you did, again, that would just be an indication that you might want to see a sleep physician.
We do have some questions that were sent in ahead of time.
Okay, great.
So the first question we have is, why do my thoughts keep racing in my sleep most of the time?
So again, that's often a sign associated with insomnia, and that is felt to be one of the subsets that can contribute to insomnia. People who have a little bit of a, I don't want to say outright anxiety, but they get into bed, they think about everything that's going on during the day. These are often the people who plan their day out very well. They're worried that they're going to miss something the next day. And so they get into bed at night and they think. And then that can end up preventing you from falling asleep. Those are the people that I mentioned the worry diary for. So those are the people who, before they go to bed, should check out their calendar, make sure they know what's going on the next day. They might want to write things down, make sure their to-do list is ready to go, and that can sometimes transfer some of those racing thoughts onto paper, and that allows people to fall asleep better.
Great. Thank you, Dr. Rowley. And we have a question in the chat from Stephanie. She said, do you have any tips for someone who cannot stay asleep past a certain hour? They follow all the good sleep hygiene tips and fall asleep promptly, but cannot sleep longer than 5 to 6 hours and cannot fall back asleep after waking up. Great question, Stephanie.
Yeah, it is a good question, Stephanie. And I don't think I have a simple solution for you. I guess my first question would be, how do you feel during the daytime? There are some people who are considered short sleepers, meaning that they are people who can sleep 5, 6 hours and be fully awake during the day, because sleep is in itself sort of a bell curve, like a lot of things in biology. So 7 is what most people need, but there are people on either end of it as well. If you do feel, though, that you need more sleep during the day, there can be a variety of reasons for that. Often something waking you up at night. So something like sleep apnea, restless legs, or periodic limb movements, something environmental that you may not even quite be aware of, but the environment's very important for how you stay asleep at nighttime. That would be my initial answer. It really depends on how you feel during the day, whether or not more workup would need to be done.
All right. And we also have a question from another participant who asked, are there any specific considerations for peri or menopausal women?
Yeah, that's a very good question, and to which I don't really have the greatest answer, because you're correct. Perimenopause is associated with the onset often of poor sleep from the hot flashes. And that also turns out is when sleep apnea can start being more prevalent in women, particularly if they are overweight and they might have been a light snorer beforehand. They become a heavier snorer afterwards. So usually if there is any evidence of like a sleep apnea, something going on, then definitely think about coming in to see a sleep doctor. And if you're someone with a bad hot flashes and stuff, then you probably should talk to your primary care or your OB-GYN, because I think there are some non-hormonal ways that can help with some of those, but those would be sort of outside my purview as a sleep doctor. But the key thing is to practice the sleep hygiene as well, because that's often when a woman can start doing bad things because they think they're good for them to help them sleep, and it ends up actually making things worse over the long run. So you really want to practice some really good sleep hygiene as you're entering that age range.
And we have another great question from Taylor in the chat. She asks, what resources are available if we notice some of these signs in children? For instance, my 7-year-old sometimes struggles with staying asleep throughout the night. Additionally, have you noticed any correlations between poor sleep habits and ADHD or autism?
Yeah, so really great question. So children definitely can have sleep disorders as well. There are, to my knowledge, at least 2 sleep centers here in Chicago for children. We have one with Dr. Patwari. There's one at Lurie's. I honestly don't know if University of Chicago has one. I think they did, but I'm not sure they do at the moment. So there are definitely resources available if this is a problem. 7-year-olds, again, you can have sleep apnea in a young child. You can actually have restless legs in a young child. So if there's any evidence of those things, those would be reasons to think about getting them to see somebody. There is definitely correlation between poor sleep habits and ADHD. There's evidence out there that children who sleep poorly often aren't sleepy, they're hyperactive. And there is a lot of evidence that a subset of people with ADHD actually the reason is a sleep disorder. Okay. I don't want to say most people with ADHD. If you have a child or even as an adult being worked up for ADHD, a good neuropsychologist is hopefully going to ask you some sleep questions and potentially get you in to see a sleep doctor to do that. Autism is also definitely a lot of associations with sleep disorders. And I would say that you'd probably want to talk about that with your whoever's taking care of the autism, or again, go see a pediatric sleep physician.
Tammy K asks, what tips do you have for shift workers who find themselves sleeping most of their days off, who are also tired during the day and have trouble driving home after long shifts?
Yeah. So there are a couple things I can suggest. The bigger problem is that society, the best solution would be to completely shift yourself 7 days a week, which society just really doesn't let you do, right? It would be great to say that you could stay awake 7 nights a week, but then you'd have the inability to get groceries and shopping, and although a lot of that can be done now 24/7, but you also have kids at home, stuff like that. So usually the important thing is that on your off days, it is recommended that you actually go try to fall asleep sometime into the later part of your shift. So let's say you're working a 12-hour shift. You probably should not allow yourself to fall asleep until 1, 2 o'clock in the morning, and not go to bed at 10 like everybody else. That does help keep you a little bit circadian shifted and allow you to be better aligned when you do have to work at night. It is also difficult sometimes to get enough sleep during your day shift, during your shifts, right? So a lot of shift workers only get about 6 hours of sleep at night. Again, because they get home, they're wired, or they have to get the kids off to school. They might sleep 5 or 6 hours. Then the kids are home, or the husband's home, or and so actually catching up a little bit of the extra sleep on those other days is actually important and key. The other thing about driving home is that if possible, you need to have kept as much light on during the day, during your shift as possible. Now, that's a little bit difficult at a hospital because we try to keep lights low for patients, but you should try to expose yourself to as much light as possible during your shift. That will help just postpone when you feel sleepy and hopefully not into your driving time. During the summer hours as well, it's important to wear sunglasses on your way home, even if it's somewhat cloudy. Because again, it's the light in the morning that helps determine your bedtime at night. And so trying to avoid a little bit of that will help you not feel again as sleepy during your shift. However, there is a subgroup of patients who, despite doing these things, feel sleepy during their shift. We actually can treat that with medication and would encourage you to consider seeing a sleep doctor in that situation.
Thank you. That's great advice. And I did not know a lot of that stuff, especially the sunglasses when driving home. So I know that we touched a little bit on alcohol use and supplements possibly, but Kevin just asked a great question in the chat about cannabis. So have there been any studies on using indica cannabis edibles to aid in sleep?
I really don't have a great answer to that. The sleep literature does not support the use of cannabis for a lot of things, but there's also not a lot of great literature. And that's because research on the use of cannabis has been mostly outlawed in the United States because it's a controlled one substance. And you're not supposed to do research on controlled one substances. There's also some thought that there may be a difference between the person who uses it every once in a while versus the person who's a regular marijuana user. And that we see the same thing with opioids. If someone who's opioid naive takes like something like an oxycodone at night, they're going to sleep all night long. Okay. But someone who's used to taking oxycodone for some other reason it doesn't do anything for their sleep anymore. So I usually tell people that it's just something you sort of have to just sort of find out for yourself. If you feel that a CBD edible before bedtime helps you sleep, then so be it. But I would not expect that everybody would have a similar positive response, because it really is going to be dependent upon a whole host of factors, including how much CBD is actually in the edible, because we all know that these over-the-counter products, lots of variation in what's actually in them.
And then I had a question. So we talk about seeing a sleep doctor a lot. I've even heard about sleep studies. What would a sleep study look like for a person?
Yeah, good question. So sleep studies are primarily done only for people who we suspect sleep apnea. Chronic insomnia is a clinical diagnosis and is usually treated with it's called cognitive behavioral therapy or sometimes with medication. Don't need a sleep study for that. And then restless legs is also a clinical diagnosis, though usually we can just go right to treatment. Sleep apnea, though, does require us to determine if you're not breathing, if you have periods of not breathing at nighttime. So there's two ways of doing sleep studies these days. There's a home study and a study that's in the laboratory. And we try to do homes. We try to start often with sleep home studies these days, and actually depending upon your insurance carrier, they actually may require it. The type of device that we use here at Rush is a very simple device. It sits on your wrist. There's a probe that sits on your finger that tells about your oxygen and the tone of your arteries. And there's a patch on your chest that tells us if you're trying to breathe or not. And we can determine if you have sleep. You just take it home with you, you wear it overnight, and we can determine if you have sleep apnea. There are some people who are more complicated, or we suspect more different types of, there are different types of sleep apnea, and we suspect more one of the other subtypes that we would do a study here in the center. For those that you come in, we actually put some EEG wires on your head to tell us if you're actually sleeping. There are sensors to tell us about your breathing and the effort and your oxygen levels during the night. And then we usually have an EKG lead and a lead on your legs to tell us if your legs are kicking at nighttime. And again, those are usually done for people who we think might have a subtype of sleep apnea, or they're more, maybe it's not as clear if they have sleep apnea. So we want to see, it's the more definitive test than a home study. So we sometimes do it in people that are less likely to have it, just to be definitive.
Thank you. And then I have a personal question for you. What is your bedtime routine?
But in my bed right
Yeah.
I'm a decent sleeper, so I've always been able to. We generally watch the 10 o'clock news, generally watch a little Jimmy Kimmel, and then just get ready for bed and get into bed. It's actually common knowledge. I actually do have sleep apnea, so I do wear CPAP. So part of my sleep ritual is getting my CPAP ready to go and getting it on at nighttime. But I would say we very much, I'm a morning exercise person. So, I'm not doing a lot of activity at night. We've generally watched some type of TV and the news before we go to bed. But I do have work to do. I usually do it earlier in the evening. So I have a period of downtime before I actually try to go to sleep.
And then I was wondering, in terms of if you were going to incorporate movement in your bedtime routine, what would that look like? What do you think would be helpful?
Again, it should be something that's more in a relaxation mode. So, for some people that might be yoga, meditation, something like Tai Chi, probably, but you don't want to be on your Peloton or your exercise bike just before you go to bed, because that's just going to stimulate you. It gets your adrenaline going, and that's just going to wake you up. So if you want to do some type of basic movements, again, something like a yoga or Tai Chi, where it's a lot more calm, I guess is one way to say it, might be the better way to go.
I have one more for you.
Mm-hmm.
And I was going to ask, for those times where we do have insomnia that we experience, right? It could be a mood, it could be anxiety, whatever that looks like. And let's say we wake up in the middle of the night, it's 3 a.m. What do we do?
Right. Yeah. So, I would tell you for what's considered short-term insomnia, the first couple of nights you just sort of let be, sort of see what happens. But if it starts going on for a week or more, that's when you really got to kick in the good sleep hygiene practices. So, because otherwise you start to learn behaviors that end up causing the insomnia to become chronic. So again, the key thing is not going to bed unless you're sleepy, trying to keep that bedtime consistent. If you can't fall asleep within 15 to 20 minutes, you actually need to get out of bed, go do something calm, read, whatever, no electronics again. And then when you feel sleepy, you get back into bed. The thing that most people sort of allow to happen is they try to stay in bed awake, trying to fall asleep. And then your body starts thinking that it's okay to be awake in bed. Okay. And you don't want your body to think it's okay to be awake in bed. Your bed should be a sedative, not a stimulant. Okay. So again, if you can't fall asleep in 15 to 20 minutes, out of bed, feel sleepy, get back into bed. You keep repeating until you fall asleep. And you should also do that in the middle of the night. So if you wake up at 3 o'clock and you try 15 to 20 minutes to go to sleep and you cannot, you should get out of bed again. And then when you feel sleepy, get back into bed. I must admit, I don't do that one as much as I should when I do have an occasional problem with middle of the night insomnia. But in theory, you should be doing those things because that will help prevent the long-term insomnia down the line if this starts as a more short-term event.